Some men feel embarrassed about their bladder control problems. The good news is that urge and stress urinary incontinence can be treated. Welcome to Medical Made Easy. In this video, we are going to talk about enlarged prostate and urinary incontinence, symptoms, and treatment options for treating male urinary leaks. The involuntary release of urine is known as urinary incontinence, and it can eventually occur in some men with benign prostatic hyperplasia, or BPH. One of the modifications in bladder function brought on by BPH is overactive bladder, which may be connected to incontinence. Normally, when your bladder is only halfway full, your brain signals that it's time to go. This serves as a decent warning for you to locate a restroom. The urinary sphincter is a valve that opens to let the bladder empty when you decide to let go. The bladder wall's muscles contract inward to release the stored energy. However, in case of overactive bladder, the bladder's muscles contract without much notice. This causes a strong want to go to the bathroom. A man may experience anything from a minor leak to drenched clothes if he is unable to contain his urine until he gets to a bathroom. Two frequent urogenital issues that affect males are benign prostatic hyperplasia, BPH, and urinary incontinence, UI, urgency, frequency, and nocturia, are lower urinary tract symptoms, LUTS, that are linked to urinary incontinence. Functional, urge, stress, and overflow are examples of UI types. The kind of incontinence, patient-specific circumstances, and treatment choices of patients and healthcare providers are taken into consideration when treating underage drinking. Modifications to the surroundings, disposable incontinence products, pelvic floor exercises, medication, surgically implanted devices, and intermittent catheterization are among the options for managing urinary incontinence. Lower urinary tract symptoms may potentially be linked to BPH. Treatment decisions are based on patient's symptoms, which are evaluated using a measurement instrument like the American Urological Association Symptom Index. BPH can be managed with medication, surgery, and minimally invasive techniques. For lower urinary tract symptoms that is not responding to conventional pharmacotherapy, anticholinergic medications, 5-alpha reductase inhibitors, and alpha receptor antagonists, either separately or in combination, are helpful and successful. Although transurethral resection of the prostate, TURP, can be used to treat BPH, it has a higher risk of problems than other surgical and minimally invasive methods. The following are some signs of BPH in males, though not all will experience lower urinary tract or incontinence symptoms. Urinary retention, or the inability to completely empty the bladder. Urine containing blood. Ejaculation in reverse. Dribbling after voiding. A rise in the number of urinations. Dribbling in the urine. Inadequate flow of urine. UTI or urinary tract infection, a strong want to go potty. The degree of symptoms and the size of the prostate gland do not appear to be correlated. Options for treating male urinary leaks. Urge and stress urine incontinence can be addressed, which is a good news. It could be necessary to use a mix of treatments. In most cases, the medical team will first suggest less invasive therapies before exploring alternative options in the event that the patient is not helped by them. Options for treatment consist of behavioral strategies. Some people's symptoms of urine incontinence can be improved by changing their lifestyle. This can entail scheduled bathroom visits, double voiding, and bladder training. The medical staff can advise cutting back on or staying away from acidic meals that stimulate the bladder, coffee, and alcohol. Exercises for the pectoralis muscles. These workouts are not limited to females. The muscles that support the bladder and penis and regulate urine are strengthened by these activities. Surgery may be beneficial for men with stress urinary incontinence in order to stop inadvertent urine leaks. Based on your medical history and physical examination, your healthcare team will decide if you are a good candidate for this kind of surgery. Some men experience embarrassment due to issues with their bladder control. By packing extra clothing, wearing absorbent pads, or staying indoors, they might attempt to manage on their own. However, there are efficient ways to deal with incontinence in the urine. It is critical to discuss treatment options with your medical team if you want to resume an active and self-assured lifestyle. Thank you for watching my video. If you found this video helpful, please give it a thumbs up and do not forget to subscribe to my channel for more informative content. Also, please do not forget to share with your loved ones. And as always, stay happy, stay healthy. Till next time, bye-bye.